Hello, everyone. My name is Tanya Finkbeiner, Chief Development Officer for the Purdue University College of Veterinary Medicine. We are excited to engage with you, the clients and friends of Coin Veterinary, over the next 3 evenings in order to help you better understand and care for your beloved pets. First and foremost, our great thanks to Dr. Coin and his staff for making this possible. We admire your passion for your clients and patients, and thank you for allowing us to share our knowledge. Secondly, thank you all for joining. Tonight, I'm happy to introduce Dr. Paulo Gomes. Dr. Gomes is our clinical assistant professor of veterinary dermatology. Grab a pen and paper and take some notes as he discusses causes, symptoms, diagnoses, and treatment of allergic skin disease in dogs.
Hello, everyone. Thank you for joining us for this presentation. I'm Paulo Gomes. I'm a clinical assistant professor of veterinary dermatology at Purdue University Veterinary Teaching Hostel. And what I would like to bring to you today is allergic skin disease in dogs. Allergic skin disease are a common cause of itching in dogs, and itching is so prevalent in the canine population that I decided to bring a few topics here to discuss. And maybe if you have some questions, feel free to reach out to us later on. So itching is one of the most common symptoms associated with allergy in the canine population. And that itching, it can be localized, meaning in a restricted area of the skin, for instance, ears or face, front paws. It's quite common in allergic dogs. But it can also be generalized when the dog is itching all over the body. And they can itch, even stop playing to itch or stop eating to itch, wake up at night to itch. It can be a constant chronic problem for dogs with allergy. So today our goal is to take a closer look on the 3 most common hypersensitivity skin disorders affecting dogs and common cause of itching, such as flea allergy, dermatitis, also referred as flea allergy or flea bite allergy, food allergy, and atopic dermatitis. Atopic dermatitis is also known as environmental allergy. So many people will refer as atopic dogs as dogs with environmental allergy. Starting with flea allergy dermatitis. Now, flea allergy dermatitis is definitely one of the most common pruritic skin disease of dogs. And if you hear me saying pruritic, I mean itching, because that's the technical terminology for itching. And especially if you live in a tropical area or in warm climate areas, that can be a bigger problem year-round. Fleas are very small, blood-sucking insects without wings, and their distribution is worldwide. There's over 2,000 species and subspecies of fleas. But for us, especially in dogs and cats, we are more concerned with the cat flea, also known as sand flea, which is the one that causes more problem in pets. So the flea life cycle starts when dogs acquire fleas from another dog or from the environment. New adult fleas will often jump into the animal, and then there are 4 life stages in the flea life cycle. One is the adult flea. Okay. The fleas will deposit their eggs on the dog will scratch, and then the eggs will be shed on the environment, so we have flea eggs. Those eggs will then develop into larvae. Then they will pupate, so form a flea pupa. and then a new flea will emerge from the pupa, and then the cycle continues. Now, adult fleas, what we see in the dog, only represent a small portion of the flea problem. What we see as adult fleas in the dogs is about 1 to 5% of the total flea infestation. And the biggest problem is in the environment, in those immature stages that we just saw on the previous slide, in the form of eggs, larvae, and pupa. And those are in the environment, in the carpet, area rugs, a sofa, the dog's bed, and cracks and crevices on hardwood floor, for instance. And when the pets become itchy because of a flea allergy dermatitis, it's not necessarily due to the number of fleas or fleas walking and crawling on the surface of the skin. It's that when fleas will bite the animal to have a blood meal, they will inject saliva in the pet's skin. And that saliva can be quite antigenic, and dogs can develop a hypersensitivity, meaning an allergic reaction to several components of the flea saliva. To illustrate what we just saw, I brought here the flea population pyramid. That is to illustrate that what we see in our pets, it's a small portion of the problem, mostly adult fleas that will represent 1 to 5% of the flea infestation, and the massive environmental problem is in the immature stages of the flea life cycle, meaning the largest number of early stages of the flea life cycle is in the form of eggs that forms the base of the pyramid, then larvae, then pupa. Pupa is only about 10%. But as we can see, of a great concern is not only the pet itself, but also the environment that the pet is in. The outdoor environment can also be problematic in some instances. Outdoors, what we have to be more alert is about the shaded, protected areas, like under decks, porches, crawling spaces. Fleas, they like an environment that is kind of humid with lower temperatures, protected from the sunlight. So in the outdoor environment, those are the areas that we have to be more concerned with. Also, we need to remember that we have urban wildlife that can come at night or even during the day in some cases, and bring fleas to our immediate environment. For that reason, we also recommend not feeding stray animals of any kind, because they will be the ones bringing the fleas close to our houses. On the other hand, in the indoor environment, the biggest problem is where the infested dog, spends most of its time, most of his or her time. That will be pet bedding, carpets, area rugs, cracks and crevices on hardwood floor. Now, if we take a closer look at the indoor environment, sometimes we see that beautiful puppy on the carpet, and we are just seeing that apparently has no problem. But if we were able to look microscopically into that carpet, that probably, if it is a house that has a flea infestation problem, that's what we would likely see. So what we are seeing on this image, we see the carpet fibers, and here we have dander. It can be human, it can be animal dander. That dark brown material that we are seeing, those are flea feces, also referred as flea dirt. They're based composed of digested blood. So fleas will have a blood meal and then will digest the blood and will excrete digested blood. So those are flea dirt. We also have eggs. We have a couple in this, but if you look closely, you see that they are all over. And we also have larvae. So there's a big one right here, quite obvious. But you also will see larvae elsewhere on this picture. There's another one right here, a little bit less obvious. So this we usually don't see, and that is where the biggest problem. And if you don't take care of the environment, meaning cleaning and take care of those immature life stages, the flea infestation will perpetuate for years and years unless you take care of the environment as well. Now, talking about adult fleas will spend most of their time on the pet. Adult fleas, they are very efficient in reproducing. They are kind of reproductive machines. And once they start reproducing, they are permanent ectoparasites. What does that mean? So if they start laying eggs after they acquire a new host, they will not go from one pet to a different pet. They stay with that pet lifelong. Now, before they start to become reproductive active, they can go from one pet to another, but that is only about 15 to 20% of the fleas will usually do that. Now, when a new flea finds a host, it starts feeding almost immediately. Within a few seconds to a few minutes, they are having a blood meal, and they are passing feces and are also producing eggs. So they start producing eggs within 24 hours. And why is important to know that? We will see in a few slides later that knowing that allows us to control the flea infestation better by preventing the fleas from reproducing. We'll talk more about that in a few minutes. Now, during the peak of production, each flea may lay about 50 eggs per day. So if your pet has hundreds of fleas, that will be thousands of eggs a day. How do we identify a flea infestation in a dog? How do we diagnose flea bite allergy or flea allergy dermatitis in a dog? So dogs of any age can be affected. The hallmark of the flea allergy dermatitis is itching. And the lesions is quite characteristic because most of the time our pets will have lesions along the dorsum towards the lower back, also on the tail, and some animals will also have problems on the abdomen inguinal area, medial and caudal hind limbs, so in the inner aspects of their legs. And in some cases, they may become generalized. When the flea infestation is too intense, the problem will be all over the body of the pet. Now, the cat flea or sand flea, it prefers dogs and cats. However, in the absence of dogs and cats in a flea-infested house, or when the flea infestation is too intense, those fleas will also bite humans. But they will prefer pets if they have that option. Now, not always fleas are obvious on the physical examination at the veterinarian's office. Sometimes you just see the itching, but you may, if you don't see adult fleas, that does not exclude flea infestation. We can still see flea dirt on the dog's skin. And if the dog has not been on a flea preventative medication, that does require treatment to completely rule out flea bite allergy in many cases. Now, when we start looking carefully on the skin of a dog with flea bite allergy, that's what we most often see. So we see an adult flea on the skin of this dog. Also note how the skin is quite red and inflamed. But if we don't find fleas, we can see large numbers of flea dirt. And that's what we have in this whole area right here. A lot of flea dirt. So this is quite diagnostic for a flea infestation. If your patient is itching or if your pet is itching with that amount of flea dirt, definitely there's a problem there with fleas. Now, treatment, how to treat a flea infestation and how to prevent that to become a chronic problem. So the goal of any treatment for fleas is to kill that fleas very fast before they lay eggs. So we need to kill the existing fleas fast and the newly acquired fleas rapidly enough to prevent them from laying eggs. Like as a species, if you cannot reproduce, you will go extinct. And that's the goal here. So prevent flea reproduction. And also, when you kill those fleas or the newly acquired fleas quite fast, you will decrease the amount of saliva that they will inject into the animal's skin when taking a blood meal. So they will die quite soon, and that will keep the pet under the itching threshold. It requires a certain number of flea bites or a certain amount of flea saliva antigens to be injected before the patient become pruritic, become itching. So we want to decrease the amount of flea bites in case of the newly acquired fleas, and also kill them fast so they don't have time to lay their eggs. And that means killing fast, killing them within 24 hours. Now, in addition to treat the pets, and I would like to highlight here that in case of flea infestation, we need to treat all pets in the household, dogs and cats, and if you have other animals that have a flea infestation, they also need to be treated. Even though if they are not itchy, it's important to treat it. Now, to treat the indoor environment, the best approach is cleaning. Basically, vacuuming on a regular basis, if you can do that daily until you have the flea infestation resolved, that would be great. And the rationale for that is that you're removing from the environment those immature stages that we saw early on. So we'll be vacuuming flea eggs, larvae, and flea feces, because flea feces is important for the development of flea larvae. They feed on that flea dirt. So wash bedding, regular vacuuming, and then dispose of that material in a sealed plastic bag. That should be enough. Now, in severe infestations, you can also make use of chemical control, of insecticides for the indoor environment, or you can hire like an exterminator to help with insecticides indoors. And the problem, when you start a treatment for a flea infestation or a flea allergy dermatitis in a dog, usually the fleas, they do not go away with the first treatment. It takes some time to extinguish that biomass that you have in the environment. So we'll be killing the adult fleas in the dog, but you still will have those larvae, those eggs developing into larvae, then pupae, then new adults, and you need to keep treating the dog until all of those immature stages are extinguished. So you're doing the mechanical treatment of the environment and also treating the pets. Now, realistically, how long we should be able to resolve a flea infestation in the indoor environment? It depends of how intense the indoor cleaning is, but in average that will take about 8 to 12 weeks. And treating the pets, it's very important too. Now, some people will treat the pets only even if when there's not problem with a flea infestation or flea bite allergy, only in the spring and summer. But dogs with flea bite allergy or dogs with food allergy and or atopic dermatitis, they can also be allergic to fleas. So in those dogs that have other types of fleas, treating the year-round flea preventive medication, it's very important to prevent flare-ups. Okay, so now let's discuss food allergy. And the diagnosis of food allergy and environmental allergy is they are a diagnosis of exclusion. So you have to exclude other causes of itching before considering food allergy and environmental allergy. Basically, we need to rule out mange, and flea bite allergy. So what is a food allergy? Food allergy when an animal, when a dog or a cat, they are allergic to some of the food ingredients that have been offered for the pet. It's more or less uncommon if you compare that with flea bite allergy and environmental allergy. The prevalence is about 1 to 10% in the canine population, but it's not that uncommon or not that rare to have pets with food allergy and environmental allergy at the same time. So they are not exclusive. So pets can have both of them. Now, if we just going to look in general, a food allergy is less common and will affect about up to 10% of the canine population. Also interesting is that a dog or a cat may be eating that same diet for years and never have problem with it, and then start having a problem with itching. Or it can be a newly introduced diet or any ingredient of food. It can be also treats, for instance. Now, what are those offending allergens on food? Most commonly is the protein source. I know that there's a huge concern about grain-free diets, but that is not the biggest problem for dogs and cats. So the carbohydrate source of the protein is a minor source of allergen for dogs and cats. We should really be looking at the protein source. So when we change the diet to a grain-free diet, in the vast majority of the patients, that will not make a difference in a dog with food allergy. Anyway, so what are those food allergens? What are those proteins that are more commonly causing food allergy in dogs and cats? In dogs, beef, dairy products, and wheat are the most common. So wheat is a carbohydrate. Then it comes chicken, eggs, lamb, and soy that will account for about 25% of the problem. And less likely, corn, pork, rice, fish, or food additives. In case of cats, the biggest food allergens are beef, dairy product, and fish, and that will account for about 80% of the food allergens in cats. So what are the clinical signs associated with food allergy? Usually it's itching, but the itching is initially not associated with the lesion. So the itching precedes skin lesions. And pets can be scratching the face, ears, axilla or armpits, feet, tail base, ventrum, ear margin. And food allergy tends to be year-round. There's no seasonal component associated with food allergy. And in some cases, not the majority, but in some cases, about 10 to 15% of cases of food allergy, the pets can have some gastrointestinal signs. What would be those signs? Probably soft stools or diarrhea or itching on their end. So that can be a problem. But most of the time, our patients, the primary clinical signs will be itching. Now, it's very important to consider that food allergy and environmental allergy can look clinically exactly the same. And if there's no seasonal component, if the clinical signs are year-round, we cannot differentiate both conditions just looking at the animal. We need to do some diagnostic tests and a food elimination diet trial to be able to differentiate between food allergy and environmental allergy. Now, if there is a seasonal component, meaning the pet's only itching during the spring, summer, or fall, any of the seasons, and then the pet has no problem during the winter, for instance, that basically rule out food allergy. But as long as there's a year-round component, food allergy and environmental allergy cannot be distinguished based on clinical signs alone. So the only way to diagnose food allergy is performing a food elimination diet trial. There are some serum allergy testing available, but that does not correlate with the clinical disease. Again, the only way and the best, the more efficient and effective way is doing a food elimination diet trial. And that diet can be individualized for each patient, and it needs to be based on a careful dietary history. So we need to feed the patients proteins and carbohydrates that the patient has never been exposed before. So we're giving a totally new source of protein and carbohydrates. Just switching dog food brands is not helpful. In addition, most commercial foods, especially if they are not prescription diets or over-the-counter diets, they contain similar ingredients and can be contaminated with common sources of proteins and carbohydrate. So we need to feed them a commercial hydrolyzed diet or a single novel protein homemade diet for about 8 to 12 weeks. So a minimum of 8 weeks, and that needs to be exclusive. And what we'll be doing, we'll be looking if the itchy level in the patient decreases as we feed the hypoallergenic diet. If it decreases by 50% or more, we will likely do a food challenge to confirm our suspicions of food allergy. If during that 8 to 12 weeks the itching has not changed on the food elimination diet trial, then it's not food allergy. Now, what would be the advantage of using a homemade diet in contrast to a commercial diet? Well, there's no additives. There's only one source of protein, only one source of carbohydrate. The disadvantage is that that's not nutritionally balanced, and it can be expensive, and it takes time to prepare food for our pets. Now, commercial diets, they have the advantage to be easy to feed and easy to acquire. They are nutritionally balanced, and because of that, they are preferred if we are doing a food elimination diet trial in young animals. So if they are 10 months old or younger, they would benefit from a commercial diet because it's balanced. What would be the disadvantages? More often there's one source of protein and the presence, there's more than one source of protein and the presence of additives. Just keep in mind that in good hypoallergenic diets, even though if there may have more than one source of protein, they are hydrolyzed and the pet should not recognize those proteins as an allergen. So if the patient responds to the food trial, we'll do the challenge. So we reintroduce the old diet, and when we reintroduce the old diet, we will expect the itch level to increase, and that's the only way for us to confirm food allergy. And that challenge can be up to 15 days, 14 to 15 days. If the dog is true food allergic, sometimes we see the itchy response coming 1 or 2, maybe 3 days after starting the challenge. But we need to keep, in some cases, we need to keep going up to 14 days to be able to tell if the patient is food allergic or not. Okay, so the food trial has 2 phases. The phase 1 is the food elimination diet trial, and phase 2 is the food challenge, that you challenge with the old diet and see if the clinical signs reoccur. The treatment for food allergy is quite straightforward. We need to identify and avoid the offending food ingredients. Another option is to feed the animal a limited ingredient or hydrolyzed diet lifelong. There are hydrolyzed and limited ingredient dog treats, so that can be used for treats as well. Or you can keep the dog on a hypoallergenic diet and then challenge the patient with different types of diets to find which one the patient will react and which one the patient will tolerate. So you can have a few options of what diets to feed your pet. Now, food allergy cannot be cured, but it can be treated. And it is a lifelong treatment. Okay, so I think we are done with food allergy. Let's move to the next topic, which is atopic dermatitis. Atopic dermatitis is also known as environmental allergy. In the past, couple of decades ago, maybe people would refer that as inhalant allergy. That's not the case anymore. That is primarily the sensitization to environmental allergens occurred through the skin, primarily. So the correct terminology is atopic dermatitis, also known as environmental allergy. Pets with atopic dermatitis, there is definitely a breed predisposition, and they will develop itching and inflame the skin. Many animals with environmental allergy and food allergy, they can also develop ear infections and skin infections as a secondary problem. And in some patients, those skin infections and ear infections can be the only clinical signs. So it can be tricky at times. If you treat a pet a couple of times for ear infection only and there's no apparent underlying cause, investigate for food allergy and or atopic dermatitis. This disease has an incidence approximately of 15% in the canine population, and part of the pathogenesis of the disease is associated with abnormal skin barrier that will predispose the allergens, the environmental allergens, to penetrate the animal's body through the skin. Now, just a quick overview of the pathogenesis of the disease. I will not go in excessive details here, but it's just to illustrate that it is a complicated pathogenesis, and it's not like one treatment will help every single patient. You need to tailor the treatment for each specific patient because there are several pathways involved in the development of atopic dermatitis. So basically, you have an abnormal skin barrier that will allow the allergens to penetrate on the skin, and that will be recognized by what we call antigen presenting cells. Then we'll have a neuronal stimulation. So basically those allergens and some cytokines as a result of those allergen stimulation will be sending signal to the brain telling the dog to itch. And there's also an inflammatory component that you have a lot of inflammatory cells infiltrating the skin from the bloodstream. And over time, we start seeing a very inflamed skin, and the skin can start become thick and leathery. So those are signs of chronicity. And of course, the dog scratching will also perpetuate the problem because it will traumatize even more the skin, allowing more allergens to be penetrated, favoring the development of skin infections caused by bacteria or yeast, and that becomes a vicious cycle. Now, many of the allergens involved with atopic dermatitis involve pollens, house dust and house dust mites. Those two are one of the most prevalent cause of allergy in dogs. So house dust and house dust mites, storage mites, molds, and dander. The clinical signs for environmental allergy start at young age. Most dogs will start having clinical signs between 1 and 3 years of age, but you can also have younger animals or a little bit older animals developing that. but we don't tend to see allergies starting after 5, 6 years of age. Most of the time, it's just between 1 and 3, with a few exceptions. The clinical signs can be seasonal or non-seasonal, and sometimes it starts as seasonal and gets year-round, so it gets worse over the year. Any breed can be affected. And it's not uncommon to have patients with recurrent ear infections and skin infections. The diagnosis, as I mentioned prior, is a diagnosis of exclusion, but we do perform a skin test and a serum allergy test, and the goal of those tests is only to identify the potential offending allergens. When we do those tests, we already know by exclusion that the dog has environmental allergy. And once we know those allergens, we are able to customize some what we call allergy-specific immunotherapy. Many people know that as allergy shots, and there's also the option of sublingual immunotherapy, oral drops, to try to desensitize the dog's immune system from those offending allergens. And that's how skin tests look like. Basically, we clip the hairs on the side of the animal close to the rib cage. We have positive control and negative control, and then we inject a series of 73 different allergens, and we give some time to react. The animals are sedated to do this test. And you can note that in this case, this animal had quite a few positive reactions. Each one of those wheels that are very red is a positive reaction. So you can tell that this patient had quite a few positive. Most of this row, for instance, is negative, so the patient did not react. Okay, then after the test, we apply some topical anti-inflammatory, and most of the time pets have no problem at all with the test site. Treatment. There are a few options. The gold standard treatment is allergy-specific immunotherapy, also known as allergy shots or sublingual immunotherapy. If started earlier in life, there are better chances that the animal will respond to this treatment modality. It is the safest, it is the gold standard treatment, and highly recommended, especially if we start that at early age. There's also the use of anti-itchy and anti-inflammatory medication that will treat only the itching. It will not necessarily desensitize the animal's immune system against those environmental allergens. Antihistamines work very little for allergy, because if you remember the quick look that we look at the pathogenesis, it's a multifactorial disease, and antihistamines will help very mildly in those cases. Essential fat acid supplementation, that's adjunctive therapy, and you can offer essential fat acids via the dog's diet. There are good commercial diets that are rich in essential fat acids. Prescription diets and topical medications. So topical medications will be medicated shampoos or topical ointments or leave-in conditioner to help to remove those allergens from the surface of the skin mechanically when you are bathing the dog, but also help to prevent infections and also help to moisturize the skin and has some anti-inflammatory activities. So topical medication is very good, especially when you have the allergy controlled and you want a long-term treatment to try to prevent flare-ups. Now, what's the prognosis for atopic dermatitis? Atopic dermatitis is not a life-threatening disease, but we cannot cure. We can only control. So be a lifelong treatment. many of the patients with atopic dermatitis, as well as food allergy, they will develop secondary infections, and that needs to be treated. Only the treatment for allergy will not resolve the infection, so we need to treat the underlying cause, which is the allergy, and then we also treat to the secondary infections. And no single treatment will be effective to all patients. So we need to do a very good diagnostic test, identify the causes, the offending allergens if possible, and then develop a treatment plan specific for that individual, specific for that patient. So I think we are concluding our presentation. If you want more information about the dermatology service at Purdue, you can visit a small animal website. Here's the web page. And you can also call the small animal hospital. Here's the number. And the procedures that we offer, that we often perform in dermatology, is the allergy testing, the intradermal allergy test, as you saw in the picture, serum allergy testing. We can also do some advanced imaging exams such as CTs and MRI to identify possibly middle ear infections in patients. We can also do a video otoscopy, where with a scope we go in the ear canal and we see a high definition image on the screen, real time. That's very important for diagnostic purposes and also treatment, as we can also flush the ear safely and very deep compared to the regular cleanings that we use at home. Okay, so feel free to visit our website for more information or call the Small Animal Hospital at Purdue. And I hope to see you on our next opportunity.
Thank you so much, Dr. Gomes. As he mentioned, please do feel free to keep in touch with us via the dermatology website. Don't hesitate to send your questions to pdmgiving@prf.org. We hope that you were able to take away some useful information this evening, and we hope to see you again tomorrow night when Dr. Stephanie Tomovsky shares her take on interesting neurology facts and tidbits for the canine owner. Thank you.